Hello children of a lesser joint, and welcome to today's video module. This is four-sector diagnosis, a systematic approach to temporomandibular joint disorders and orofacial pain diagnosis, part 2. The last video segment highlighted an approach to diagnosis called four-sector diagnosis. In the top left quadrant is the professional questionnaire that I use, which gathers a substantial amount of information that the patient will provide in terms of symptoms, past and present medical history, medications, and family history. I have 4 of these boxes, and they're just a place for me to demonstrate how I manage collecting information. The idea of the four-sector diagnosis is to bring all that information together so that I can get a disease-based diagnosis, hopefully. In the symptom questionnaire, which is present in the group files under Dr. Gottesman's Professional TMJ Facial Questionnaire, is the cover page of this document. You'll notice on the cover page there are currently 26 categories, and these categories provide me with what I call a diagnostic axis indicator score. 26 boxes, DAIS. If a patient has 26 of these boxes, you can presume that there is going to be a lot of illness in a lot of different categories. And you can take the time to print this out and take a look at these boxes. On the lower half of the page, I have a substantial amount of room where I can create notes, so I have a quick reference at my disposal when I'm done gathering the information. I can also check off or highlight each of these boxes so that I can see at a glance what that patient presents with, and then I will know what I think I have to do with that patient in terms of getting an accurate diagnosis. The questionnaire provides us with a spectacular communication tool, which I call a diagnostic communication capsule. More importantly, it provides an inter-provider core language, so between doctor and doctor I have a way to describe my cases and presenting symptoms and known findings that the patient may present with in terms of past blood studies or imaging studies. And it helps us to work together in order to act in this patient's best interest. For the patient, of course, it is going to be a resource that hopefully leads us to a diagnosis and maybe more effective care. So that's the purpose of this. That's why this exists. And I will go through this in future lectures page by page, but rather than bore you and do all of the 17 pages of questions at one time, I think it's better to move and create interest in the lecture so that I have your attention and I can maintain it. What I'm going to do in this particular lecture is to just give you a short overview about how I use the top left box, which is the symptom-based diagnostic axis indicators, in order to use that as a feeder mechanism to get a disease-based diagnosis. Now, I can use any of these boxes as a feeder towards hitting my target area, but I'm going to start out in this area over here on the top left just for today. And notice how I can also not only do the diagnosis myself, but if I feel I need help along the way, I will generate referrals, whether that be for imaging studies like MRIs or CT scans, or I'm going to send to, let's say, a rheumatologist or a hematologist. That becomes part of my pathway in order to obtain diagnosis and treatment. What I do when I start out with the symptom questionnaire is I'm going to build what's called an overlap model. I'm going to take all of those symptoms, see if it looks familiar to me, build an overlap model, which is any one of a number of diseases that patient could have, and convert it into blood tests. I will format the blood tests, send them out to the lab for testing. So this is just one part of it. It excludes right now all the rest of my quadrant histories that I need to get and symptoms. The goal here is to get that arrow that I'm using, which is that overlap symptom, into my target area. I call this a strategic support diagnostic network. And this network uses multiple resources, as I described, as what I call feed generators. So they're moving me and the patient towards getting a disease-based diagnosis. Once I get information, and this part of this is completed, which could take several weeks, depending on how many blood tests I'm going to convert this into, we're able to generate at that point what's called a reciprocal diagnostic affirmation. In other words, if I'm using all four of those sectors or quadrants, the information that I am able to extract, which then becomes validating in terms of the diseases that that patient may have that they didn't know about as potential causes for their particular facial pain or temporomandibular joint disorder, I can then take that affirmation and do what I call a reconciliation. This becomes very important to the practitioner, because what I'm then doing is I'm comparing the diagnosis, which I call the affirmation. I've proved it out. It's present in the blood, hopefully, and I will go back and I will look at the symptoms. I will look at the markers that I got for the blood tests that were positive and negative, because I'm excluding certain diseases as I'm going along, compare it to my imaging studies, particularly the MRI, and I will take a look at all of the diagnostic indicators. I'm only showing you 3 of them here, but certainly the physical exam would carry many clues, and I am going to remember that. I'm going to take a look. I'm going to see what type of abnormalities were present on the MRI. I'm going to look at the position of the disc. I'm going to look at the position of the condyle. I am going to look at lesions in the condyle. I'm going to look at inflammatory responses, not only in the condyle disc assembly, but in the entire surrounding area, and I am going to remember those. And I will make a list. And then these become part of what I call my diagnostic assets. These become the payload now for future patients to come in and for me to remember what it was that all of my patients present with, so that I can develop a library in my head that tells me what my potential diagnostic assets are when I'm reviewing my findings for a particular patient. So this becomes very important because this becomes part of your experience as a practitioner, and it helps you to become a better diagnostician. So when you see certain clusters in your imaging studies, or you see certain clusters of symptoms, you can then go ahead and project and convert that in your mind as to what you think that patient may have. This becomes really helpful in streamlining the process that you and the patient will go through, because if you can get earlier hits, it cuts down on the time and expense that your investigation may involve. So I am going to conclude today's lecture by telling you the next time when you return, I will show you how to build an overlap model taken from symptoms, and then the lecture after that, I will show you how you use that reciprocal type of affirmation in taking a look at imaging studies and projecting through them, in addition to the symptoms, what that patient may have, how I make decisions. So I hope you will join me next time when I'll be rocking it out with Jaw Talk. Stay tuned.